But really, if you do it in the clinical realm, it's a bit of time consuming to do this. So we are trying to work and see if there's any other methods that we can adopt in our clinical practice. So what we did is we have collaborated with our engineering department in our university, and we've developed the OCT device together to examine our patients without needing to do skin biopsy on our patients. And we have did some publications in the past utilizing this device to examine lasers, hyperpigmentation, melasmas, melanin evaluations. And recently we just published it in bioengineering this year by using the high resolution OCT device to evaluate our vitiligo grafting patients. It's a prospective longitudinal follow-up studies up to 6 months.
Yeah. Surgical interventions are very important alternatives to refractory vitiligo. A variety of surgical interventions are available. And today, I would like to introduce the recent advancement in punch grafting. Traditional punch grafting use 1 to 2 millimeter manual punch instrument. It is the fastest, easiest, and least expensive method. Also, it's very straightforward and successful, but its major limitations include its time-consuming nature and cobblestoning. So, I'm sorry. Yeah. We developed micropunch grafting using 0.5 to 0.8 millimeter motorized micropunches. It can markedly reduce both operation time and complications. To briefly describe this process, normal micropunches are usually taken from the post-auricular area and implanted into vitiligo regions.
This trypsin will destroy the cells. Another alternative is putting it in a fridge at 4 degrees Celsius, and this is how Professor Gauthier started it, but it is a bit time consuming, so most of the people now are just using the incubator in our country. So after taking it, we we wash it with saline. Some people put trypsin inhibitor, others use patients on plasma to inactivate trypsin. But all of this is almost the same. We've been using saline and it was very good. And then we put it in a centrifuge for 5 to 10 minutes at 2000 RPM. Afterwards, we take it out, we remove the supernatant and add the final suspension medium, which we use, we use phosphate buffered saline or PBS.
Cell suspension and cell culture. I mean, the non-culture and culture, do you need to perform it in a GMP settings?
Okay, I think every therapy has its advantages. So when we treat just like the lips, just like lips of the eyelid, with I think the micropunch may be the wonderful therapy. But if we to treat the very large area of the vitiligo, I think the culture therapies will be the good one, just as our engineering the culture, the epidermal sheet, and then because we can use the very small skin sample and we can to culture a very large area. And if you will treat the very large area, if you we use the suction blister, and maybe we will spend a very long time to do this surgery, I think. But if we use the, we can culture the very large epidermal sheet, and we can to reduce the surgery time. I think different part of the body, and we can try the different therapy. I think every surgery.